Good morning, everybody. I think we're just about ready to go. Thank you for joining us today. This is Amy Hewitt. I'm the Executive Director of the Scleroderma Research Foundation. We thank you for joining us. This is our 19th live webinar, and I'd like to remind everyone that our entire series, as well as the other patient and research-related news, are available to you on our website at sclerodermaresearch.org. Our webinar series is made possible through a generous grant from Gilead Sciences. We thank them for their support. The goal of the SRF webinar series are to educate our community about research, treatment options, and how to better manage the disease. Today's session will center on the role of managing lifestyle to improve patients' quality of life. It is now my pleasure to introduce our special guest. Dr. Susan Nyanzi has been a scleroderma patient for most of her life. The challenges and successes she faced led to her doctorate in public health with a subspecialty in chronic disease management, specifically in autoimmune disorders. With the goal of protecting and promoting health, Dr. Nyanzi counsels on how to eat right, move well, manage stress, and have a good supportive social network. As a professor and patient advocate, she presents at local national conferences, writes for local magazines, and is a reviewer for the Arthritis Care and Research Journal. Frequent SRF webinar attendees may recognize Dr. Nyanzi, as she was a recent participant this past October for a patient's conversation about scleroderma. That topic, or the interest from that webinar on the subject of lifestyle, merited another webinar devoted to the topic. The phone lines have all been muted, so we encourage you to ask questions using the chat box in the conference window. Remember that our webinars are for educational purposes only, and no information provided is to be considered personal medical advice. It is now my pleasure to turn the presentation over to Susan and how to manage scleroderma with lifestyle. Welcome, Susan.
Good morning, Amy. Can you hear me?
I can. Good morning.
Good morning. And again, a big thank you for having me.
Oh, our pleasure.
Again, and also a big thank you for all of those who are tuning in by webcam, by the computer system and also by the phone. Big thank you. So hopefully this will be a fun and interesting presentation. I've added some new stuff in there, and hopefully we'll also learn from it as well. So a little bit about my degree. So I'm a doctor of public health. It's a terminal degree that is public health practice. In other words, instead of just doing academia, we're also out there in the community doing things with the community and the individual. Then I'm also a master certified health educator. That means that I'm able to get large amounts of information, like from the literature, from research, funnel it down into simple terms that the general public and the everyday person can understand. And I'm also a member of the American College of Sports Medicine and the British equivalent, which is the Fellow of the Royal Society of Public Health, and I'm also gluten-free certified. So kind of going into the presentation now, as in what is lifestyle. So the word has been so overused now that it's really lost its meaning, but the true meaning of the word is how we as individuals choose to live our lives by how we move, how we eat, and how we manage stress, kind of combining all of these together so that we can increase on a quality and enjoyment of life. So not just in the short term, but also for the long term. 10, 20 years from now, we still want to be looking good, living well, and enjoying life. And I'm going to give you a question, and we'll kind of think about it, and later on towards the end we'll answer it, or maybe people already know the answer to this. Guess who is the quickest growing segment of the population? I'll just leave it to that for now. So lifestyle is not just important for the general population. It's even more important for those of us with chronic conditions, because they are things that we can do ourselves. We don't have to rely on somebody else to tell us how we can manage our health. We're living it so we can control it. So now, before we jump into things, a little bit about my discipline, public health. So public health is different from the medical model in that we focus on the 3 Ps. We focus on protecting health, promoting good health habits, and preventing things from getting worse. So we look at the person as a whole. We look at the mind, body, and spirit, and how all of this works together on improving one's wellness level so that you can be the best that you can be most of the time. Now, if you Google wellness, you'll see everybody and their grandmother does wellness. However, the true wellness, there's a science behind it, and it requires advanced training. So kind of looking at the wellness, at the illness-wellness continuum, we want to be more towards the blue-purple side. And so by looking at all of the elements I talked about at the top, we want all of those working together so we can move along our continuum of wellness to be the best that we can be most of the time. So what is the benefit of a healthier lifestyle? So this one I think is a no-brainer, but I'll just give it anyway. So improved quality of life. So with improved quality of life, you're not in bed, you're not sick, you're not going to the doctor, to the different subspecialties we have to see. There's less of those. So you've got more time to do what you like to do. You've got more time to do what makes you happy. You can spend time with family and friends. You can spend time traveling. You can spend time doing your hobbies. You can even spend time advocating for more research in scleroderma. Now, it'll also help with avoiding less medication. So with each medication comes a string of side effects. Now, those side effects could mean that those medications can interact with other medications, or that medication can interact with the foods that you're eating as well. So again, there's a big cloud in there. If we can take less medication, fantastic. Then it's also, we have less aches and pains. So it's easier to move around. Easier to move around. We can do more things. You know, we can hit that dance floor in style. We can even get off that dance floor in style. Now let's look at physical activity. So I'm going to explain it this way, and that's why I've put the U.S. Surgeon General guidelines. So the U.S. Surgeon General puts out guidelines for the general population and also for those with chronic conditions. And this comes from research that has been done. So a whole bunch of research was done, and they call this evidence-based research. So this will be peer-review articles. So they went through the rigor of research guidelines, and they showed that patients with chronic conditions that exercised at least an hour and a half a day felt better, lived longer, enjoyed life. Now I think I heard a gasp with 90 minutes per day, but you can break that up. If you break that up into 10, 15-minute sessions, that's actually even better on the body as well. So you don't want to do it all at once, get tired, and then don't want to do it again. We want to build up on it. So if you can do 10 minutes in the morning and then another 10 minutes at lunchtime, just break it up during the day. Now, you can also increase your daily activity as well. So sitting is actually not our friend, especially for scleroderma. We need to keep moving. So, you know, if it's going to take you a longer time to do the housework, but at least you're moving. You're doing something different than just sitting. Now, the study of happiness, positive psychology, showed that people who did activities they enjoyed, they gained the most out of them, in that the body released a good amount of the happy chemicals, muscles relaxed, they moved better, and moods were a lot better too. So most probably people around you were also happier because you were in a happier mood as well. But it's important that you pick activities that you like. You know, some people think that they have to go to the gym to get a workout. No. If you don't like the gym, I'm not one for the gym. I'd rather do things outdoors. So I do walks in my neighborhood. We've got hills and valleys. So I do get a workout. I just start narrowing the time I do it in, and I'll still get a good workout. and a good effect out of it that way. So it's always best to do the activities that you enjoy most. If you like dancing, if you like gardening, go ahead and do those. Now, how do we go about doing this? So with scleroderma, the muscles, most of us who have muscle involvement, the muscles are tight and the joints are tight. So what I usually say is, when you wake up, have a nice warm, long bath or shower. If it's 15, 20 minutes, fine. But at least get those muscles and that skin nice and relaxed and moving. And then, of course, we've got to put on lotion. There's Vaseline, there's Eucerin, there is Aquaphor. Make sure you put a good amount on to also help with the skin to loosen up as well. So after you've done that, then follow it up with some stretches. Now, these should be gentle stretches. And so you're going to stretch your body part. You'll hold it for 10, 15 seconds, and then you'll release. And then you'll go into the stretch again gently. Hold it for 10, 15 seconds and release. So do that about 3 or 4 times. So that will be 3 to 4 repetitions. And make sure you hit all of the major body parts when you do the stretches. Now, a lot of people think that when they bounce, they're going to go further, and that will help. That's actually pretty bad because you're shocking the muscle, and then the muscle will cramp up on you, and you'll end up in more pain. So not a good idea to do that. Now, even if walking or standing might be an issue, chair exercises count. I did a couple of chair exercises kind of just to check it out. I got a workout, and you do sweat, and you do get a good workout. So integrate some of those in there. The American College of Sports Medicine has some good examples, or even Googling and also doing YouTube videos as well. There's good exercise routines. And I think the Scleroderma Foundation has a video on the exercises that can be done as well. Now, after you've done your exercise, you want to stretch again. The reason for the stretching, again, is to cool down the muscles. After you've done your stretching, a good 5-10 minutes, because we really do need to stretch those out properly so we're not going to get in pain or going to shock them. Then we're also going to drink a full glass of water as well. That does 2 things. It's going to hydrate the cells that were working, the muscles that were working, and it's also going to help get rid of the lactic acid. Lactic acid is the byproduct that the muscles produce when they're working out. And actually, they're the ones that contribute to soreness the following day. When we drink water afterwards, we're kind of washing those out as much as we can. So what does physical activity help us with? What does it do for us? Well, if we have high blood pressure, it's going to help improve that. And how does it do this? It relaxes the blood vessels. So the heart doesn't have to work as hard as it does to pump the blood around the body. And so when we're exercising, the heart needs to get the blood to all the body parts that are working. When it does that, it needs to get all of that blood to the place as soon as it can. So there's a big rush of blood going through the blood vessels. So this causes the blood vessels to expand. Okay, so that's one method. Then the other thing that it does, it also gives the heart a workout as well. The heart is a muscle itself. So because the heart is pumping the way, it has to pump to get all this blood out. So when it opens, fills up, it really tries to fill up as much as it can. And so because the muscle is strong now, it can push really hard to get all of that blood out of the heart to the body parts. So because now it's working efficiently, it doesn't have to pump as hard. And when it does that, then the heart rate goes down, and also the blood pressure goes down. Okay, so then looking at the arteries as well. So we talked about the arteries expanding because a lot of blood is rushing through. to get to the muscles that need the energy. And so after we exercise, the blood isn't rushing as hard to all the body parts because now we're at rest, we're stretching, so things are calming down now. Well, it takes the blood vessels a while to kind of come back to normal size, but they're still dilated, expanding. And this is when you can see that when you take your blood pressure, and I usually do this as a trick to people to show that exercise really does lower your blood pressure, you will see that it lowers it 5 to 10 points. So you can move from high blood pressure into moderate or moderate into normal ranges. And if you do this on a regular basis, the body is going to get used to it, but eventually your blood pressure is going to go down. And then hopefully you can reduce your blood pressure medications because, again, they also have side effects. Now, the other way that the blood vessels help with good health is with lowering cholesterol. So we talked about how they expand and then also how they relax back. Well, that movement kind of causes like a vibration movement. So if there's any plaque stuck on the sides of it, it will kind of break off. We want that to break off because that's the bad cholesterol. And then it gets washed away and gets rid of by the liver. The other thing that physical activity does, it increases our happy cholesterol. The happy cholesterol, HDL, those are our friends, and we like those. So think of them as the jackhammers. They patrol the blood vessels looking for cholesterol that is stuck on the arterial walls. So let me see if I can get to the picture. So on the diagram here, we see this plaque. We see this plaque in the blood, in the artery there. So what the jackhammer does, it will come, take all that plaque off, put it in its little bag, take it to the liver, and the liver will get rid of it. So we want that to be high. So the next time you're looking at your lipid panel, look for your HDL, and we want that to get high. And now we know that physical activity is one way we can increase it. Also, physical activity burns those extra calories, so we're not going to gain weight. It'll help us maintain the weight we're on. And it also releases the feel-good chemicals. So we're less stressed, we don't have the blues as much, and people around us are also happy because we're feeling happy. It also increases energy levels. Increases energy levels because the good chemicals are released. All of the cells now are well oxygenated, well fed. We're feeling good. We're loosey-goosey. Our range of motion is improving. So if you feel like doing some Mick Jagger moves, you're more than welcome to. Oh. Okay, so now let's look at what it does to the joints. So joints are also important with us with scleroderma. So it helps the joints and muscles stay flexible, which is a good thing, so we're not always stuck in one position. And looking at the second diagram, I like this because now it shows how physical activity can also help with bone growth as well. So when we, I hope I can do this right. Okay. So this is the muscle that is working. This is the muscle that is working. A working muscle gets stronger. When it gets stronger, it starts pulling and pushing on the bone. Here is the bone. So the action of the pushing and pulling on the bone causes the bone to start making new cells. When the bone is making new cells, it's in a way growing, becoming more dense. And we want that so that you won't get osteopenia or get osteoporosis. So that's how we can prevent it that way. Osteopenia and osteoporosis is common in scleroderma patients because of the medications we take, And then also we're not as active. So another reason for why physical activity is good for scleroderma patients. One other last thing, what it does around the joints is reducing pain. So now we're more flexible, we're loosey-goosey, we can do the Mick Jagger moves, and the muscles are strong as well. So with both of those together and the joint areas being well nourished, pain goes down. Pain goes down two ways, because the joints, the muscles are working well, they're not squeezing on the nerve endings. And I'm trying to see that it shows on the picture there, but nerve endings are also embedded in here. But if this is working well, then they're not squeezing all on top of each other. Then the area is also getting well nourished, so it's getting rid of all the excess pro-inflammatory cells in the area. So we feel good. Okay, now let's look at the types of foods we can eat. And I purposely put those foods there as a visual. So we can see this is, it looks like fried chicken, fried okra, and I think it's macaroni cheese. Well, all of those are fatty foods. They could also be processed as well. Well, all of these are going to cause pain. They open the pain pathway. Pain pathway means we're going to be cranky, means we're going to take medications, a whole bunch of them, just to feel semi-normal or not to feel so much pain. If that's not for you, we have the second option right here. And so with this one, okay, let me go back one step. The fatty foods are high in omega-6 fatty acids. Omega-6 fatty acids are the ones that open the pain pathway. These foods are low in omega-6 but high in omega-3 fatty acids. Omega-3 fatty acids are pretty much our friends. They are anti-inflammatory. Omega-6 are pro-inflammatory. And it's actually healthy. You're not going to gain a whole bunch of weight on this. You will gain a couple of pounds on this. And this one is a nice, well-balanced meal. You're getting your veggies in, you're getting your protein in, and you're getting your complex carbohydrate in. So with less pain, you're happier, you're not cranky, and hopefully less medications are taken, even just to enjoy the food. So as I said, this is a balanced meal containing all of the elements I just talked about here. Now, it's always better when you use real organic foods, so real organic fruits and vegetables, and 100% grass-fed meats. Why I'm talking about 100% grass-fed meats, they are high in omega-3. Omega-3 are our friends. The corn-fed foods are high in omega-6. Omega-6 is pro-inflammatory. So we want to avoid those as much as we can. So many of us, let me just go back one more step. So we now know this is the type of food we should be eating. But we're still not feeling quite too good. So maybe there's more detail or more things we need to look into in more detail. So here comes the food allergies. Now, many of us have GI problems, and as a result, we're going to develop food sensitivities or allergies without really realizing it. It won't be until we try and figure out what works for us and what doesn't work for us, what makes us cranky, what doesn't make us cranky. Then we kind of just start eliminating the foods that way. Most of the time, so you might think, your general doc should be able to pick it up. Well, the symptoms are so vague that if nobody's looking for it, they won't find it. But usually the subspecialty physicians, when it's in really bad condition, usually pick it out because the they're used to seeing this. But now I'm also giving you the tools to kind of figure out whether you have these allergies or sensitivities as well. So some of the common symptoms, again, osteopenia, osteoporosis, that doesn't seem to get better whatever medications you're given or infusions you're done. Feeling fatigued all the time, even when you get up. Unexplained anemia that drops every couple of months, and you're always on iron supplements or infusions. Foggy brain most of the time throughout the whole day. And I know, when I used to always complain about it was, well, that's part of scleroderma. Or it's, well, that's what the medications do. And then, of course, the neuropathy, the tingling in the hands and feet. I would also try and find solutions for that, but it was, well, that's part of scleroderma. But they are things that we can do. Even though it's all put under the umbrella part of scleroderma, it could be food sensitivities. And then just another note to add on that, one could be saying, okay, how do we get these food sensitivities and food allergies? I never used to have them before. Another part of the puzzle, which is now gaining a lot of interest in the research area, is bacterial overgrowth. So as I said earlier on, many of us with scleroderma are going to have GI involvement. And so now they're seeing that bacterial overgrowth, when it becomes excessive or when it becomes a lot, it causes a lot of food allergies and sensitivities. And so there's a scale and there's medications for trying to control the bacterial overgrowth. But when it becomes really, really high, then different options are taken that way. And we'll talk about it more onto this slide. So we're going to focus on gluten. So the old school of thought was that genetics played a major role in food allergies. If you had the gene for that specific food, then you are more likely to get that allergy. And we'll take gluten as the example. Well, now it's showing the genetics only has 20% of a role, and the environment has 80% of the role. The environment we live in and how we move, how we work, our lifestyle has a greater impact on the food and sensitivities, the food allergies and sensitivities that we're going to get. So in scleroderma, how would this go about? So we've got the slow movement gut because we've got GI involvement. GI involvement means the structure within the gut is also going to change as well. And as it does that, the cells that used to be, not yet. So we have structural changes. They're going to be taken kind of down here where the muscles are. It's going to result in slow gut movement, so slow peristalsis. With slow peristalsis, bacterial overgrowth really takes on. The bacteria is growing as crazy, it's enjoying the environment, growing as much as it can. Well, then it has byproducts that then break down the gut lining, which is here. So the normal cells should be all touching together, and all of these microvilli, this is where absorption takes place in the small intestine. All of these are nice, straight, ready to pick up any food that comes rushing across. So they're ready to absorb the food because once it's absorbed, it comes down here, and then it goes into the bloodstream, and it goes where it needs to go. Well, if we have gluten or dairy or corn, they feed the bacterial overgrowth. It breaks down the gut lining, and because these molecules are really big, they start squeezing through here. So the bacterial growth, the bacterial byproducts, is killing the lining of the gut. These molecules are pretty big. They're still swimming around, but they see an opportunity to kind of sneak down in here, and they shouldn't be going in there. So anyway, they sneak down, go into the bloodstream, and the immune response goes, we've got an invader, we've got to kill this agent. So they come, try and kill it as much as they can, but it's too big. Instead, it makes it into a bigger and bigger molecule or a bigger and bigger complex. So think of this complex as a fireball. This complex now is a huge fireball that is in the bloodstream that can now move and go wherever it pleases. And as it goes wherever it pleases, it can catch on fire on other molecules within the area and cause inflammation. So looking at this slide, we can see areas that mimic the clinical symptoms of celiac, and they match up pretty well. So the complex, when it's in the abdomen where we just were, it can react. So when it's in here, it's causing some reactions here in the small intestine, and that's how we're going to get leaky gut. And of course, the symptoms of that is, we all know it, gas, you look 9 months pregnant, you're not absorbing well, and a big stomach. Then it can also move within the joints, within the joint area. So imagine it as a ball of fire catching on some of the cells in there. So you're going to get joint pain, aches and pains that are going to mimic rheumatoid arthritis. Now gluten, corn, and dairy are the few molecules that can cross the blood-brain barrier. That blood-brain barrier is usually very protective and doesn't allow a lot of things in there. But gluten, corn, and dairy, and by the way, all of them are not fully digestible within the body system. They can cross the blood-brain barrier and start attacking the different parts of the brain. So when it attacks the area that controls depression, we get more blues, we're more depressed. When it attacks the area that controls balance, we're dropping things, tripping, not feeling too good. And then, of course, it also brings on foggy brain. So foggy brain is when it's attacking the front part of the brain that's associated with cognition, remembering things, or high-level thinking. So that's where foggy brain comes in. And what it's actually doing, it's reducing the amount of blood flow in that area. And also what happens with the brain, to kind of keep it nice and supple and moving, it has a cerebral fluid that usually surrounds it. Well, these foods also decrease that fluid. So you kind of get a double whammy. And so that's why you're tired, depressed, can't think too well. And so it is a major issue. So every year I go to the National Celiac Conference, and some years back I was listening to one of the leaders in the celiac field. And the way he kept saying, and I think it was to a patient, that think of gluten as rat poison to those that are sensitive to it. It's rat poison because it's killing the different parts of the body, or the different body cells, different body parts. So it's important to take it seriously and to take care of it. And as individuals, we can actually control this part by not consuming gluten. So there was a study done that showed people who had gluten. One group were gluten, and they went 100% gluten-free. Another group had gluten issues, but they didn't go gluten-free. After some years, they did some measurements, and they looked at their brain, and they looked at those who ate normally, but still had gluten issues. Certain areas in the brain were decreased dramatically. Those who ate the gluten-free, these areas healed, and actually also the lining of the gut also healed. So absorption started taking place. Whereas with the other group, The lining was still dead. No absorption was taking place. So it is a major issue to fix. So where do we start? So I was talking about a gluten-free diet. So this is preparing things from scratch. No processed foods, and I'll explain why. Packaged, canned, and frozen foods. As a lining, they either add corn, gluten, it's mostly corn or gluten, so that the food doesn't stick to the containers. Especially for the frozen foods, they use gluten and corn for those. Another way of getting good information is from local and national conferences. These are fantastic. We have the National Celiac Foundation here in Southern California, and they hold a conference each year. And I've seen that different parts of the state, they hold their own celiac conference. So I advise people to kind of go and visit those, because they have the specialists, the gastroenterologist specialists who know about scleroderma and celiac or scleroderma and food sensitivities, and then they can direct you in the right places as well. Now, there's also a lot of information out there online, and also the books. So, all of us are thinking of, we've got to buy all of these books, especially for some of these actresses or these famous people. But so many of them have half-truths that it's not even worth spending your money on it. So usually, if you want to buy any books, go to your local celiac foundation or the national one, or find support groups in your area, and they have usually a good collection. The one we had here, we used to exchange books like crazy, and we knew which ones were the good ones and which ones were not. Some years back, Elizabeth Hasselbeck on The View had her book out because she had celiac. But our support group leaders told us not to buy it, and I think they got it from the national office because it was riddled with mistakes. So a good way to assess whether you're getting a good book is to look up the author, look at their credentials, what discipline do they have, what experience do they have, and then also who's financing the book. Some of these big food companies are financing these books and putting a famous name on it, but half of the information in there is not true. Also, blogs by regular people are another great way to get resources and to get help. Another option is the Paleo Diet. So the Paleo Diet, kind of similar to the all from scratch kind of a thing. So it's about, and it's also grain-free as well. So it removes all of the grains that contain gluten. And by the way, they are other grains that naturally don't have gluten. And then there's now some which can be made without gluten. But some people react to them, so you might have to do a trial and error thing. But with the Paleo Diet, these grains are removed. It's mostly protein, so which are going to be your lean meats, wild caught, remember, omega, because they're high in omega-6 fatty acids, and then wild caught fish. Hold on, I said that wrong. 100% grass-fed meats and wild caught fish. And let me explain why that. So we already touched on the 100% grass-fed meats. Those that are corn-fed are high in omega-6. Omega-6 opens up the pathways for pain. The grass-fed ones, 100% grass-fed, are high in omega-3. Omega-3 is our friend because it blocks pain, it makes our skin look good. Okay, and then with the fish, we want wild caught. And I have the acronym there, SMASH. This is the fish that are highest in omega-3 fatty acids. So the first letter stands for salmon, mackerel, anchovies, sardines, halibut. So I'll say that one more time. Salmon, S, M for mackerel, A for anchovies, S for sardines, H for halibut. So these fish are naturally high in omega-3 fatty acids. And so if we can have 2 to 3 servings of those per week, then we have a good amount of omega-3 in our diet. And let me explain why you don't want to do farm-raised or sustainably raised fish. They're fed pellets. Those pellets contain either corn or gluten. And so the wild caught is always better because it's not eating corn or gluten in the sea. It's also, going back to the paleo diet, it's also full of fruits and veggies, and we want all types, all the different colors, all the different types, because all the different colors have different elements that we need. And then also eggs are good if you don't have reactions, and then nuts. And the pictures, I've included these pictures so we see that paleo can actually be good and also be filling at the same time, and also to kind of remove some myths about how soups should look like. So this is a nice, healthy, balanced soup. It has a lot of stuff in there that is nice and meaty. This is a nice, balanced burger. We've got the meat, 100% grass-fed, and we've got veggies, and we also got another veggies here, but at least you can taste this one. And then this is how a salad should look like. It shouldn't be mostly lettuce and then covered in a cheesy sauce like ranch dressing. This is a nice balanced one. We've got the protein in there, we've got the veggies in there, and it's also filling at the same time. So now what about eating out? So you might think, okay, so I have all of these food allergies. There's no way I can go out and eat. It's going to be a disaster. It's going to be a nightmare. No, there's actually a way of doing it, and this is what I do when I'm going out. I plan ahead of time. And so once I know where we're going as a group of friends, I will call the place a couple of days ahead, insist on talking to the chef or the head person of the kitchen, and then tell them my allergies, tell them what I'm allergic to. Usually it's better to tell them what you can eat. And I actually even take it a step further and offer some meal options as well. That way they're not freaking out as much and they have a better understanding of what they can do. With some of the restaurants or the hotels, the chefs, the young ones especially, want to practice or want to try out new things. So they're more than likely and more than happy to help you out. And I also insist I have violent food allergy reactions. You say it that way, then they take it more seriously and they don't think it's just a fad, especially for us in LA. There's so many fads that are going on. Then also on the day of, I call and remind them again, talk to the head chef, tell them what I'm allergic to, what I can eat. Keep mentioning violently sick, violently allergic to these foods. The other statement that I've started incorporating, which seems to work very well, is you wouldn't want an ambulance in front of your establishment. Then they really take you seriously. So by the time you get to the restaurant, hopefully by then they know your name and they know exactly your meal and who has prepared your meal, and there won't be any issues of cross-contamination. And by the way, don't feel bad doing this because food allergies are protected under the Disability Act. And food establishments have to provide you with a satisfying meal. So now let's look at stress and scleroderma and positive psychology. So living with a chronic condition is a full-time job. Friends and family may not get it all the time. We have several subspecialty appointments. We're on several medications. Some of them are working. The pain meds are not working anymore. We're dealing with the cross reactions that are happening. So all of this can be stressful. So now looking at the study of the study of happiness, positive psychology, it looks at the psychology of the person and how well we can be. So it looks at positive emotions, positive experiences, and positive environments. We actually have control over this, and we can create this for ourselves and make it happen. So a good support group is a good one. If family doesn't get it, we've got the Scleroderma sisters or brothers who are there to relate and can understand what's going on. So there's always someone you can share with. So social support is really, really important. And then also working in a field that you like, or doing something that gives meaning and purpose to life. So that way you're not just focusing on yourself, you're focusing on others as well. Not having a good day, we all have a good day. We all don't have good days, we have bad days. But let's try and flip it around. Let's change our mindset. Let's find humor in it, humor in the situation, and then start thinking of plan A, B, C, and D, if need be, up to Z. So we're being active, proactive. Of course, we're now eating well, so we now know what to eat. We are also sleeping well. We need to get in there at least 8 hours of sleep per night. Some of us might need 9 or 10 to feel refreshed, but get that sleep. It's a way of resetting the whole system and have it relax and start healing itself. And also move well. So we talked about the activity and the exercises that need to be done. So all of these strategies help elicit positive thoughts and emotions, and they also help build self-empowerment. Self-empowerment is, I've got control of this, I've got this. It doesn't mean we're going to control everything, but at least there's some elements that we can control and take care of. This is in good alignment with the new school of thought in psychology, especially in stress psychology, which says you need to deal with the underlying issues first. So when you deal with those underlying issues first, then the second layer of stress management can take place, which is this. But some of these can also be added to the long-term sections we talked about. And so there are herbal teas and essential oils. Now, to get the therapeutic levels of this, consult with a seasoned certified aromatherapist. They know what essential oils to use, and if you tell them the allergies you have or what medications you're on, they can help prevent the reactions, the cross reactions to take place. That's very important. Massages are another good one. The one I do and I recommend others to do is myofascial release. Why? It's because it works directly on the fascia and also the collagen. Scleroderma, we put on too much collagen. The myofascial release is going to help break up that collagen. And then fascia, what is the fascia? So if you're eating a piece of chicken, there's the skin and then there's another glassy film between the skin and the meat. That is the fascia. Well, with us in scleroderma, that fascia can get really tight, and that can cause the muscle pains and discomfort and actually affect the internal organs as well. The myofascia works on that as well. I'll give a story, and I actually found out about myofascial release from a fellow scleroderma patient. We were at a conference, at a session, and the person who was speaking, we had heard what they were saying. We had heard it all before, so we started talking. And so she was telling me she was in a wheelchair a year ago, and now I couldn't believe. I was like, there was no way. And so she told me about myofascial release. You have to go to someone who is certified and a physical therapist because they understand the muscles, the insertions, how they all work, and they'll have a better understanding of what medications to take and which ones not to take. And once I found out, certified myofascial therapist in my area, I've really seen great improvements as well with that. So, of course, there's meditations. There are all choices to pick from. Pick the one that you like the most, because remember positive psychology. Pick what you enjoy the most, and you'll gain the most out of it. And then also enhance that creative side. If it's reading, blogging, or crafting, you enjoy it, do it. It's a good stress reliever. Okay, so now tying everything together. So we've talked about all of these new habits, all of these new behaviors, how we're going to change how we eat, how we're going to change how we move, how we're going to change how we manage our stress. Now, research shows for adults to learn new habits and behaviors, they need to be educated, and then they have to be educated with evidence-based health information. Evidence-based meaning this is coming from research, up-to-date research showing what works and what doesn't work. And then also describing and showing how things can be done. And then finally, tracking progress. So as individuals, we can do this on our own as well. We can educate ourselves. If we don't have the right information, we can check with others who know about evidence-based health information. And then we can also learn how to do it. And then finally, we can track ourselves on how well we're doing. So that we can move on this wellness continuum and be more in the purple side, so we can be the best that we can be most of the time. Now, for the question I asked earlier on, as in the largest growing segment of the population, it's the centennials. And when you look at some of these centennials, they do not look like centennials, but guess how they got there? Okay, thank you. I think I'm done. Do we have any questions?
We do, Susan.
Okay.
When we have just a few minutes left, so we'll get to those questions right now. Let's see. I have one from Charla. What do you recommend for complex CHO? As a scleroderma patient, I've noticed I do better when I cut out carbohydrates, sugar, and dairy.
Actually, and that's a good point. I kind of touched on that. So the complex CHO, those are the complex carbohydrate. So as I mentioned, we have GI issues, and so we can have bacterial overgrowth. And it hasn't been until 2013 that there's a lot of research now in this. And I actually got most of this information from the celiac gurus. Bacterial overgrowth, especially in scleroderma, can become excessive and cause food allergies and food sensitivities. So if she's seeing that even with complex carbohydrates, you're having issues, that could be a bacterial overgrowth issue. So it would be a good idea to talk with a seasoned gastroenterologist. The one that I talked to, he's in Boston, but he's the top. And when I told him about scleroderma, he seemed to know it very well because he's Italian. In Italy, they used to see scleroderma patients and celiac patients. And so, I don't know, should I give you the name or send it to you later on?
We can share it with the after the meeting.
Yeah. So you want to see a seasoned GI doc to see whether it's the bacterial overgrowth. So that will be the underlying issue, so that it can take care of that.
Thank you. Doris has a question. She's asking, can side effects from gluten cause insomnia?
Yes. So side effects from gluten has up to 200 side effects. Insomnia, definitely one of them. And I can tell you, when I went 100% gluten-free and my household went 100% gluten-free, I sleep like a baby.
That's great. Sarah asked a question, is occasional wine okay with the disease?
Yes, wine is fine. Yeah, wine is fine. Red wine is fine. And occasional, yes, why not?
Let's see. Nancy's asking, and you touched on this a bit, so perhaps it's something we can share after the meeting or we can circulate. But she's asking, can you share what you do to make eating out easier for you? Do you have cards that you use, or is it?
Actually, yes. I developed some because I was so frustrated with the whole system, but I also kind of touched on what I do, and I really write it out in detail. And so, yes, if I find out where I'm going, I call them up. You know, I'm really determined. I need to talk to the head chef or even the manager. I tell all of the decision makers all the way down about my allergies. And then I also have the little card that I created to show them, no, I cannot eat this, I cannot eat that. Otherwise, you're going to have an ambulance in front of your restaurant. Do you want that?
D'Angelo is asking what kind of grain is okay.
Okay, so that's a bit of a tricky one. But there's a lot of gluten-free grains. So there are bean, flour, grains. I know that just stumped me. There are gluten-free grains, and then there are some that have been made gluten-free. But definitely keep away from wheat, rye, barley, and oats. Okay. With the oats, it has to say gluten-free. The other grains, there is quinoa, I think that's a grain. There is aramath, there's arrowroot, but it depends what you're going to be using it for.
Okay. Cindy's asking, when traveling, how do you navigate the time zone changes in eating, and is it okay to simply just eat on demand?
Good question. I actually try and stick to my time schedule as much as I can, and also try to avoid eat on demand, because that's when you can run into issues, because then you won't have, the places you go to, they might not be able to accommodate you the best. But the other thing that I do is also travel with snacks and with goodies, so that if I'm stuck somewhere, I have something that I can eat on. Or the other option, there are places where there'll be fruit and vegetables, so you can always get those.
I'm going to ask one more question, and then we'll wrap up for today. What's the difference between supplements and real food?
Good question. I'll explain it this way. So with real food, we've done research on it, and we're still doing more research on it to find out what makes, to still find out what other chemicals in there are good for us. We don't know. So with the whole food, there's still other compounds that are beneficial for us that we don't know about. But from the ones we know about, they're a lot better than the supplements. Now, when it comes also to taking them as well, with the real food or the real fruits and vegetables, they start working actually when they're in our mouth, chewing. So it also helps with oral health. With supplements, they say they also do that, but they also add a whole bunch of other compounds in there, one of them being gluten, dairy, and corn in some form. So if you are sensitive to those, you won't be able to take them, or you'll end up getting more sick.
Okay. Well, I think that's it for today. We're going to wrap up. Thank you so much, Susan, and for each of you who joined us today. We're all part of the scleroderma community, and only by joining together can we make faster progress in the search for better treatments and ultimately a cure. When you close the webinar window today, it would be really helpful for us if you could fill out the short survey. It helps us to keep these webinars relevant for you, and so we appreciate you taking the time to do that. And then please remember that we depend on your support for our continued investment in research. And we have a spring challenge going on right now that will double your impact, so all gifts through the end of April will be doubled. For more information, you can visit us online at sclerodermaresearch.org, or you can call our offices at 1-800-441-CURE, that's 2873, to support our program. And thanks again for sharing some time with us today. Our next webinar is going to be Improving Function of Hands and Face, Tips and Exercises for Scleroderma Patients, which will be held on Wednesday, May 11th at 10 a.m. again. The session will be led by Dr. Janet Poole with the University of New Mexico, and we look forward to having you join us then. Remember that this and all the other webinars are available to you on our website, so please visit us at sclerodermaresearch.org. Thank you again so much, Susan.
Great. Thank you for having me, and thank you, everybody who's on the line.
Yes, thank you, and talk to you soon.
Okay, bye.
Take care. Bye-bye.